Another study questions the Hospital Readmissions Reduction Program. Do-it-yourself diabetes tools catch FDA's attention. And measles cases reach the highest level in 25 years. Welcome to This Week in Managed Care. I'm Laura Jost. Fewer Medicare beneficiaries are readmitted to the hospital today due to the Hospital Readmissions Reduction Program. But new research in Annals of Internal Medicine adds to the argument that the program's assumptions about who influences readmissions may not be correct. The new study suggests that readmission rates varied little among primary care physicians, while the current CMS program calls for giving rewards and penalties based on their readmission rates. The authors wrote, "Our finding of minimal variation in risk for readmission among PCPs calls into question any pay-for-performance program that aims to reduce readmissions and assumes variation by PCP." For more, visit ajmc.com. FDA this week issued its first ever warning about do-it-yourself artificial pancreas systems after a patient suffered an accidental insulin overdose. Do-it-yourself systems combine approved insulin pumps and continuous glucose monitors with open source software. They appeared in 2015 after patients and parents of children with type 1 diabetes grew tired of waiting for approval of a closed-loop system to automatically dose insulin, often called an artificial pancreas. The FDA statement said, "These devices were not designed to be used together and were combined in a way that had not been thoroughly tested for compatibility." Developers of the most popular systems made a statement on Twitter calling for do-it-yourself users to report adverse events. So far, FDA has never taken action against do-it-yourself developers. For more, visit ajmc.com. The measles outbreak in the United States has reached 880 cases, the highest number since 1994. 41 new cases have been reported in the past week, including 30 in New York State. CDC officials say measles cases have now reached 24 states, and they do not know if the outbreak has slowed. The agency issued the following recommendations on vaccinations. The first dose should be given between 12 and 15 months of age. The second dose should be given between 4 and 6 years of age, and teens and adults should be up to date on the measles, mumps, rubella vaccination. At this week's meeting of the American Psychiatric Association, Alkermes presented data on an experimental combination therapy that gives patients with schizophrenia the benefits of olanzapine with less weight gain. Adam Simmons, Alkermes' Director of Clinical Program Management, told AJMC that limiting weight gain is an important consideration for these patients.
Yeah, interestingly, we did a survey of 500 patients living with schizophrenia being treated in outpatient clinics, asking about what their preferences were for antipsychotic medications in general. And some of the feedback from that survey was that, first and foremost, efficacy was the most important factor for them taking a medication. But when we asked about side effects, weight gain was one of the most important side effects for them to consider in taking a medication. Further to that, we asked about thresholds of weight gain. Patients, about 80% of patients will go on to a medication if that medication is going to cause about 5 pounds or less of weight gain. But as you kind of go up the threshold and you start asking about, well, what about 20 pounds or more? That's where we know that for 70% of patients, they either absolutely won't take a medication or would seriously impact their decision.
For more coverage from the 175th annual meeting of the APA, visit ajmc.com. Finally, the rise of the Institute for Clinical and Economic Review has been an important development in the value discussion for therapies. Whether ICER has contributed to better decision-making or a loss of choice was a highlight of this week's ISPOR annual meeting in New Orleans. Said Dr. Michael Sherman of Harvard Pilgrim Healthcare, "It helps me look at drugs in the context of not what is the price tag, but what do you get for your money?" For all our coverage from ISPOR, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.